COVID-19 has completely changed the world and the ways in which we live our lives, turning busy high streets into ghost towns, forcing us into isolation, and inciting fear in doing something as basic as seeing our loved ones. These things may have been necessary in preventing the spread of the virus, but this constant changing of the rules and the never-ending lockdowns are having a huge impact on mental health in England. Mental health has always taken a back seat to our physical health, but now more than ever, we need to start looking towards our mental well-being and take care for our minds as much as we do our bodies. We need to normalise the discussion of mental health, improving funding for our mental health services, and ensure that people who are suffering know exactly how to get the help that they need. So, we decided to make a documentary about it and explore how the COVID-19 pandemic has impacted our mental health. This pandemic has been hard on most of us for different reasons. Whether it's financial struggles, the social restrictions, being on the front lines, or losing a loved one to the virus. It has affected us all in some way or another. But we wanted to take this opportunity to give people from the north of England a chance to share their stories and experiences, in the hopes that it could help others struggling with their mental health. We reached out and were able to gather all of these amazing people to participate, to talk about their personal COVID experiences and to discuss their views on the pandemic and mental health. The effects of social distancing, lockdowns, the loss of loved ones, and the overconsumption of stress-inducing media is taking a serious toll on our mental health. Following a survey carried out by the mental health charity organisation Mind, where they questioned approximately 16,000 UK citizens of differing ages and ethnicities about their mental health during the first lockdown. They concluded that of these 16,000 participants, more than half the adults, 60%, and over 2/3 of the young people, 68%, have said that their mental health got worse during the first lockdown. These numbers have only risen, which begs the question, should we start encouraging the open discussion of mental health and our experiences with it?
My mental health was always kind of, it wasn't something I struggled with. And then during lockdown, the coin flipped. I kind of went from being someone who was very in tune with their emotions, quite, level-headed, to someone who just had no grasp on how to handle the situation they were in.
I didn't suffer with any mental illness before COVID-19, but I do still struggle with that anxiety. I know that if I'm not around people for long periods of time anyway, I find it difficult. It definitely impacted me because I lost a lot of work, and I was like, well, what do I do now? And I think a lot of people felt like that.
I've had bouts of depression on and off. God, this is awful. Most of my adult life. Oh God, it's awful saying that, but it's true. So I'd had a breakdown when I was at university about, I was like 21-ish. And since then, it's been a sort of regular, every 6 years or so, it happens. Sometimes I can manage it absolutely fine, and other times it will just drag on. I started sertraline last year after Drag Race. I was a bit of a mess, actually, after Drag Race. So I started taking only a small dose, like I wasn't taking loads. I just needed something to balance me out, because that's all it is. Just the chemicals in your head have gone a bit... So I just needed something to balance me out. And it really did. It really helped me, actually.
In times like a lockdown, you do have that time to reflect on your mental health, to actually figure out if you are really depressed and if you do really need help. Because for years and years, I thought nothing of it. I thought, no, people have it worse than me. I can deal with this, like, whereas other people can't. They should be the ones on medication, not me. I can get out of this, but you can't. Sometimes you do need that push. And I think lockdown definitely made me realise that when I'm doing something, I don't feel as bad. But when I'm not doing anything, there's a problem and I need to fix it. And that's when you know that there's something wrong, because it's not normal to feel sad all the time.
Talking openly about our mental health is the first step in normalising it. It could be the difference between someone suffering in silence and getting the help they might seriously need. We shouldn't be ashamed to talk about how we are feeling, when feeling is a huge part of what makes us human. Mental health can feel like a taboo subject to discuss in society. Approaching these sorts of conversations can seem daunting or uncomfortable, but that's only because we are taught that it's deemed a weakness to discuss these things, especially in men. This is not only outdated, but completely counterproductive to the betterment of our mental health. But what do you think?
There is still a huge stigma of or taboo that we don't talk about our feelings.
Yes, it's got more of a presence now and it is acknowledged by people, but I think it's still thought about in the wrong way. It's thought about as everyone's perfect, but then a couple of people get a bit sad and then we've just got to talk to them for a bit and then they'll get better and then we can go back to being a normal person. But that's not how it works. It's not an on and an off switch. It's a continual thing.
I think what's happened is more people have become aware how fragile their own mental health is. And so are talking about it and saying, if you need help, you can talk to me, because they have now experienced it. So there is a much greater level of empathy with actually, this is hard.
I think where we're really going to see a jump in improvement is from like sort of this generation, I say to the sort of like millennial generation, as they're having children and teaching their very young kids. It'll be at that point where they start teaching their young kids that it's fine to talk about mental health.
One of my aims, certainly with my campaign and being an ambassador, is to get mental health on the national curriculum. There's no harm in, obviously, if we teach children first and foremost, they're going to know growing up, obviously, it's a generation thing, and maybe in 20 years' time it will be different and will be on the national curriculum. But I would hope there'll be a lot more conversations happening now about mental health, and it obviously taking things, whether you know someone or not. A classic example of that is obviously Caroline Flax. You know what I mean? A lot of people had a conversation, whether you knew Caroline or not. She was adored by lots of lovely people, and it's a great example. It's a tragic example, but something like that happen I would definitely think would certainly open a conversation up.
It's harmful that we live in a society where physical illness and mental illness, they're on a scale of one's more important than the other, because realistically they're not. Just because it's not a physical illness with your body and you can't see it doesn't mean it's not important.
We need to realise that looking after our mental health and emotional well-being is just as important as caring for our physical health. Our mind and body are not separate, disconnected things. They are two parts of what makes us whole. Both are equally important in our overall health and well-being, and we shouldn't prioritise one over the other. Now, of course, during a virus pandemic, we need to focus on our physical well-being and make sure we are following the rules to stop the spread. But that doesn't mean we should ignore the clear negative implications the pandemic has had on our mental health and mental health services. These services were already strained before the virus, and this has only been made worse since COVID struck. Using a model designed by the Centre for Mental Health, forecasting the rising need for mental health support in the UK, it is predicted that nationally, in England, up to 10 million people, almost 20% of the population, will need either new or additional mental health support as a direct consequence of the COVID virus. These numbers demand action, ensuring that mental health services and organisations have the resources and funding needed to facilitate the imminent rise in demand for mental health support due to COVID-19.
We need to be there for the people that are going to be struggling. We need to make sure that they are getting the support that they need. They know where to go when they need the support.
So for a few weeks before lockdown and before the pandemic had started, I'd started going to counselling sessions again, and was finding that really helpful in terms of processing my own thoughts and dealing with my own sort of mental processes around anxiety and around feeling low and things like that. But then when the pandemic hit, obviously everything moved to being online sessions or over the phone consultations and things like that. But I'm one of those people that really thrives from having a face-to-face conversation with someone. So I was discharged from that service when I'd requested that I didn't do phone call counselling, which I guess is quite disheartening.
Unless you go private, which most people can't afford. I was in therapy for about 1.5 years, and like per session, it was a weekly, I might add, it was like 50 quid. 50 quid, and it took 6 months just to crack me, or just to crack the egg and get something out of me. Like paying somebody to talk about your feelings and they can't legally run away is the best thing I could ever recommend. But like I said, most people can't afford that. More should be done. There should be more support. There should be easier access, like getting through to the Samaritans or the crisis team. I remember being on the phone to the Samaritans for 20 minutes once. 20 minutes. If somebody's sat on a bridge or somebody's thinking about, I got something in their hands and they're like, going to do it. I'm like, it's 20 minutes to get somebody to just calm them down. I think there isn't enough out there. And I don't get me wrong, the resources that are out there are exhausted, but it's not enough. There's not enough funding.
I think the government should have done way more when it came to mental health. Mental health services are already underfunded and quite inaccessible to a lot of people, where there's so many people on waiting lists. People sadly have to reach crisis point to receive care and support that they need, and that existed before the pandemic. And I think the government should be, number one, funding mental health services more and train people to be part of those mental health services.
Put perfectly, in a study led by the Mental Health Foundation in collaboration with multiple universities throughout the UK, there will be no vaccine to protect us from the mental health effects of the pandemic. But measures can be taken to minimise the anticipated increase in stress, anxiety, depression and other mental health issues. The UK and devolved governments must plan a mental health response that gives equal importance to both mental health and the physical health effects of the crisis. Government action needs to be taken as soon as possible to make sure mental health organisations can provide services sufficiently and to ensure that anyone seeking support can access it easily without delay or disruption. And though we do need to see action from higher authorities, we should also look at methods and activities we can explore to help keep ourselves mentally healthy. We've all been in lockdown or isolation at some point during the pandemic, in a bubble or having to do it alone. We've all had to find our own ways of coping. We've had to adapt to try and find activities that can be done at home or digitally. Here are some suggestions from our participants who wanted to share their advice, give tips to stay positive and recommend activities that they've done in lockdown to help keep themselves active and motivated.
Exercise has proven to help your mental health. Even in the lockdown, obviously, going back to the government, it's the sole reason why we were allowed an hour a day out, do you know what I mean, to walk the dog, run, because it has been proven to just relax and chill you out.
So it's all about finding that thing that you love. If you have a passion and you can do it from home or you can do it safely on the outdoors, just do it. Just take that time. I mean, I have taken up yoga and meditation, and that is a massive help. So if you're into that kind of thing, I would definitely get on YouTube, get on Google, get some tips, and yeah, definitely take that up if you're that kind of person that likes that sort of thing.
Doing something just that little bit different and creative really does help with your mental health and mental well-being. And giving yourself that sense of permission to feel bad about things. I mean, we're human, we're not supposed to be constant all the time being happy and content, because we're not. We're complex creatures. So trying to steer away from technology a little bit, because it's we're processing information so fast all the time, like just non-stop. And sometimes we forget that actually we're not really supposed to be doing that. We're supposed to be taking it easy and, look at the news once a day or something like that. But for us, when we are processing information all the time, it can make us feel quite overwhelmed and overloaded. So that's another tip that I recommend.
For me, being mindful and trying to be aware of what my brain is thinking rather than just letting it get on and do its thing. Because, I'll be sat on a park bench and for no reason, then I'll be imagining that the man walking his dog will get off its leash and run at me and rip my throat out. And I'll be having this daydream where I'm bleeding to death on the floor and, people are just stood around looking and not doing anything. And I have to be aware of those things. That my brain is doing that and go, wait a minute, this is not real. Don't carry this with you. That's not going to happen. Chill out, So mindfulness and that side of stuff actually is really helpful. If you're struggling with your brain is running wild and it's telling you things that, are unhelpful.
And I just say don't put so much pressure on yourself you don't have to come out of this lockdown having bettered yourself. Coming out of these lockdowns in one piece is enough.
We've all found our own methods, whether it's exercise, hobbies, or setting personal goals. And thankfully, with the technology we have today, most of us were still able to see friends and family during lockdown. Whether it was the weekly family quiz on Zoom, or just a virtual get-together with friends and a glass of wine. These were the saving graces for many people during the pandemic. And now, with the vaccine being distributed worldwide, we're all in hopes that COVID-19 will soon be a thing of the past. There is no denying, this has been a rough couple of years, but we are beginning to see an end in sight and can finally turn our attentions towards our hopes and ambitions for after the pandemic.
Oh, my hopes for life after COVID-19 is that we can all get back to some semblance of normality. I don't think it will ever be exactly the same, but there will be a more normal that we can get to, which will mean that we can have shows and go out drinking and dancing and have a nice time and going to the theatre and doing all the things that actually make life worth living.
I hope post-lockdown, I can't wait to have a hug. Of anyone. When all this is said and done, I am just going to be stood there, just letting people hug me.
I'm hoping in a post-COVID world that I will be able to get married at some point. Due to saving for the wedding, we've not really been on many adventures. I'd very much like to get back to doing that. I really miss it.
The truth is, the pandemic has taken a huge toll on us all. Some of us lost loved ones. Some lost their livelihoods. And the after effects of the pandemic will be long lasting. But the amazing thing about humans is our resilience. Instead of allowing the pandemic to defeat us, we learnt new skills and languages. We built, crafted and baked. We innovated, we elected, we fought for justice, we loved and created. If you're watching this, you survived a global pandemic, which should be seen as a feat all in itself.
This isn't forever. I know, so badly it feels like it does, and that it is, but it's not forever.
I hate talking about my feelings. I hate it. But I just know that I'm slightly in denial, because I do always feel just incrementally a little bit better, even if it's just texting someone saying I don't feel good. Because knowing that someone else knows that I don't feel good makes me feel less alone. And I know a lot of people struggle with the idea of burdening people with that thought, but it's not true. It really isn't. You'd be surprised at how many people care.
Remember, if you need anybody to talk to, there are people out there, or just message me.
There is so much joy in this world, but we just don't look at it because it always feels like we're rushing to the next thing, or we're focusing on the negatives, or we're struggling with this, that, or the other. But it's just like, just take a second and find something like joyful in the moments in your life. Because I think if we're gonna move forward as a society and as a happier society, we've got to grasp onto every element of joy that we can, because it's only when we're in a happy and a joyful state that we can be better to one another, but also to ourselves.
We need to act now and do everything we can to ensure mental health is spoken about and that the services for supporting our mental health are being sufficiently funded. We need to use the pandemic as an opportunity to reflect on our society, incite change where it's needed, not only to better our mental well-being, but to better the world for everyone in it. It's time for us now to come together, to start building towards a safer, fairer, and kinder future. Please, if you are able, donate and give support to these amazing organisations who work extremely hard to help improve our understanding and handling of mental health and its services. These organisations are hugely underfunded, but still do everything in their ability to help anyone that is suffering. And if you are struggling with your mental health, or you just need someone to talk to, then please get in contact with the mental health hotlines for further information or advice. Don't suffer in silence, because even though it might feel like it, you are not in this alone.